The vertebral bodies are connected by intervertebral discs and anterior and posterior longitudinal ligaments. Let's first look at the intervertebral discs. The intervertebral disc is a fibrocartilaginous disc connecting adjacent vertebral bodies, except between the first and second cervical vertebrae. Adults have 23 intervertebral discs. The intervertebral disc consists of two parts, with the central part being the nucleus pulposus. It is a soft and elastic gelatinous substance, a remnant of the embryonic notochord. The surrounding part is the annulus fibrosus. It is composed of multiple layers of fibrocartilage rings arranged concentrically, making it tough and firmly connecting the upper and lower parts of each vertebra, protecting the nucleus pulposus and restricting its bulging. The intervertebral disc is both tough and elastic, compressing under pressure and restoring after removal. It has an elastic deformation effect, cushioning the spine from external forces and increasing its range of motion. The posterior thickness of the 23 discs varies, being thinner in the thoracic region, thicker in the cervical region, and thickest in the lumbar region, allowing greater mobility in the cervical and lumbar spine. The cervical and lumbar discs are thicker anteriorly and posteriorly, while the thoracic discs are the opposite. The posterior thickness and size may vary with age. When the annulus fibrosus ruptures, the nucleus pulposus tends to protrude posterolaterally, penetrating the vertebral canal or intervertebral foramen, compressing the adjacent spinal cord or nerve root, causing referred pain, clinically known as a herniated disc. Next, let's look at the anterior longitudinal ligament. The anterior longitudinal ligament is a broad, tough fibrous bundle extending along the front of the vertebral bodies, from the anterior border of the sacrum to the first or second thoracic vertebra. Its longitudinal fibers firmly attach to the vertebral bodies and intervertebral discs, preventing excessive extension and anterior protrusion of the discs. Finally, let's look at the posterior longitudinal ligament. The posterior longitudinal ligament is located behind the vertebral bodies within the vertebral canal, narrow and tough, originating from the sacrum and continuous with the membrane covering the sacral vertebrae, descending to the coccyx. It is closely connected to the intervertebral discs and the upper and lower edges of the vertebral bodies, while more loosely attached to the vertebral bodies, limiting excessive flexion of the spine. Basic knowledge of orthopedic anatomy is an essential skill for clinical medical staff, and a clear understanding of the connections between the vertebral bodies is necessary to make accurate judgments about intervertebral disc injuries. Follow us for further informative videos. Thanks for watching.